And good afternoon to everyone. Welcome to our 88th briefing on the coronavirus situation in Orange County. As always, Mayor Jerry L. Demings will start the briefing by talking about the COVID-19 numbers. He'll also discuss the extension of testing at Barnett Park and the distribution of CARES Act money. Epidemiologist Alvina Chu is here in lieu of Dr. Pino to deliver the latest Department of Health numbers here in Orange County. Now, without further ado, Mayor Demings.
All right, good afternoon. Thank you all for being here as we come virtually to the end of our week. This will be the last press event that we will hold regarding the pandemic here in Orange County. Well, a lot has gone on this week. I have my partner today, Alvina Chu. I'm going to call her Dr. Chu. She's an honorary doctor today. But let me just kind of go over where we are. I just came from an event at the Dr. Phillips Center for the Performing Arts, and the local arts and live entertainment industry is one of the sectors that has suffered greatly during the pandemic. Orange County has given $250,000 in CARES Act money to help the Dr. Phillips Group to kick off its Front Yard Festival. It's a concept that will allow musical acts and others to entertain in an outdoor performance space that will be both safe and socially distant. So kudos to the Dr. Phillips Performing Arts Center for their creativity to get us going. The Front Yard Festival will help reactivate our arts center and allow artists and their audiences to interact safely. In addition, it will give us as Orange County residents the opportunity to exhale a bit by going out and partaking of these live performances. We have been allocated $243 million in total CARES dollars and have been infusing it into our community in a myriad of ways to assist with our recovery efforts from the pandemic. However, the pandemic has not been letting up, and we must stay strong and steadfast in our efforts to help everyone. The Department of Health has provided us with the latest coronavirus numbers. The numbers were not yet updated on their website this afternoon, but we do have the numbers, and I'm going to share them with you. At the beginning of this week, I said to all of you that I would make a prediction about the milestones that we would reach this week. One of the predictions that I said we would likely surpass the 53,000 cumulative total number of positive cases in our community, and we have. There are now a reported 53,384 cases in Orange County. 619 Orange County residents have died as a result of the coronavirus, which is an increase of 15 residents since our last briefing on Monday. To the families and victims, we say to them, our hearts certainly go out to all of you during these difficult times. Nationwide, we have reached another milestone. The country has surpassed 250,000 deaths. This is a sad statistic that hits home in our county. To the families and Orange County residents, please know that we are safer, stronger together. Our 2-week positivity average is around 7.8%. The numbers are going in the wrong direction. Again, epidemiologist Alvina Chu will give you more details about our current state of affairs. Our free drive-through, a rapid testing site, continues to be in high demand for our residents. So much so that we have expanded the operation to now be open 7 days per week at Barnett Park between the hours of 9 a.m. to 5 p.m. This daily operation will continue until December 30th. Now, more residents can conveniently get tested on the weekends and especially before the holidays. We still, however, advise that large holiday gatherings should not occur. That will help to slow the spread of the virus in our community. Please remember the Barnett site is closed on Thursday or Thanksgiving next week. It will be open each of the other days. You don't need an appointment, and you can get a rapid test or the PCR molecular test, or both. Wait times vary, and the longest waits appear to be when the testing site first opens or towards the end of the day. Current wait times are between 1/2 hour and an hour. Just yesterday, Orange County Health Services administered 1,457 tests at Barnett Park. With an increased operation, we anticipate up to 8,000 residents will be served on a weekly basis going forward until the end of the year. For more information on the free testing, you can go to our website at ocfl.net/testing. On Monday, both the Small Business Grant Program and the Micro Grant Program for home-based businesses closed its application portal. Now, I want you to listen closely to what I'm about to say. Business owners who still have started but have yet to complete their applications through the portal need to finish and submit their application before tomorrow, Friday, November the 20th at 5 p.m. Applications that are not completed will not be considered for the business grant program. Now let me talk a little bit about the crisis assistance we're providing to individuals and families. As you know, we have until December the 30th to spend our local CARES dollars or return them to the federal government. It is not our desire to return any funds. We have allocated a total of $60 million in CARES dollars for individuals and families impacted by COVID-19. Those who qualified received $1,000 payments. We still have dollars available. So, we plan to reopen the application portal for individual and family crisis assistance on Tuesday, November the 24th at 8 a.m. Adult members of the same household, including roommates, and other family members are now eligible to apply. You must be at least 18 years of age to qualify. The portal will allow up to 15,000 users to submit their documentation for the $1,000 grant. Residents need to review the eligibility criteria and prepare all required documents before applying. This will be one of the last times we will open the portal. The portal may open only one other time before the end of the year, and that's the optimism that we have. If you are a resident and your income was negatively impacted by COVID-19, please read the eligibility requirements and apply. Information is on our webpage at ocfl.net/orangecares. Our health services testing site still gives away free personal protective equipment to everyone who is tested at the site. We really want our businesses to be successful, and they can only do so if they safely remain open. Our Public Safety Director, Danny Banks, is here today and has spearheaded efforts in all of our PPE distribution. Orange County government is standing ready once again to give away free PPE to small businesses located in Orange County to assist them during this pandemic. Free PPE kit distributions including disposable face masks and hand sanitizers, will take place from December the 1st through December the 3rd at the following locations: Downey Park, Cypress Grove Park, West Orange Park. The hours of distribution will be 9 a.m. to 4 p.m. Any small business in Orange County with fewer than 40 employees is eligible to pick up free PPE. Businesses are required to pre-register for this program at ocfl.net/PPE before going to the pickup locations. So far, we have given away nearly 14 million face masks and 2 million bottles of hand sanitizers. Remember, we have a population of 1.4 million in Orange County. We've given away 14 million face masks. I want to thank our dedicated employees here in Orange County, in particular those who work in health services and our fire department, who have been asked to do work outside of their normal duties to help with these various endeavors. And now let me talk a little bit about a community in need during a holiday season. As we head into the weekend, I want to encourage those who can afford to give this holiday season to do so by picking up a new unwrapped toy. Many of our families are in need like never before. On Monday, we'll be hosting a drive-through toy drive event at both Downey and Silver Star Community Parks from 10 a.m. to 3 p.m. The drive-through is contactless. In other words, you don't have to get out of your car to drop off a new unwrapped toy. With many families facing greater financial hardships than ever before due to the pandemic, this is an opportunity to give a toy to those in need in a safe way. This will be a family-friendly event, and there will be some guest stars who will be in attendance. We are partnering with area team mascots, including Stuff from the Orlando Magic and Nitro from UCF. Also on hand will be Shades from the Orlando Solar Bears, Kingston from the Orlando City Soccer, and Scooter from Orange County Parks and Recreation to help collect toys with all of us on Monday. First responders from Orange County Fire Rescue and the Sheriff's Office Mounted Patrol Unit will also be on site to support the drive and to highlight and encourage this season of giving. Again, you can drop off a new unwrapped gift for children ages 18 and under between the hours of 10 a.m. and 3 p.m. on Monday at both of the parks I mentioned. As a bonus, each participating vehicle will receive free face masks and hand sanitizers while supplies last. To learn more about the toy drive and how to donate, please visit our website at ocfl.net/toy-drive. I know that was a lot to cover. I'm going to turn it over to the Honorary Dr. Alvina Chu.
Thank you, Mayor. Thank you. I'd like Mayor Demings to maybe predict the next upcoming lottery, since you were so good with your prediction. We have, unfortunately, as of today, surpassed 53,000 cumulative cases within Orange County. Over the last several days, there's been an increase of between 50 to 100 daily, and so this increase is a harbinger of things to come. And so we are still in the middle of the pandemic, as the mayor mentioned, and so we want to maintain our good pandemic precautions. The age groups that are contributing the most to the outbreak currently remain the 15 to 34 age groups. and specifically the 15 to 24 age group. If you could bring up the chart for percent PCR positive tests in by age group in Orange County, you can see within the 15 to 24 age group, it's well over 10%. So essentially, our young people are circulating, perhaps gathering in groups, not using good pandemic precautions, and are propelling the pandemic within our county. Our recovery rate currently is at 92%. The age range of the cases is 0 to 110. The median age cumulative over the entire outbreak has been 35 years of age, which is slightly lower than when compared to the state of Florida. There have been 1,731 hospitalizations, and unfortunately since Monday, we've had 15 additional COVID-19 related deaths reported to us. Our condolences to the family and the friends of those who lost their lives to the virus. The age range of the deaths were 50 to 96 years old. 8 were female, 9 were male, 3 Black, 11 white, and 1 categorized as other. Ethnicity was 11 Hispanic and 4 non-Hispanic. 13 have known underlying health conditions and 2 have no known underlying health conditions. So we continue to emphasize that those who have some kind of underlying medical condition are at higher risk for severe illness and potentially death. If you look at the reports that come out from the state website about the age groups, the breakdown of the age groups for cases, hospitalizations, and deaths, you can see that the young people are contributing the most to the newest cases, and then they potentially spread it to those who are in their households, and particularly to other multi-generational spread is happening within households. You can see that the deaths are occurring in those who are in the oldest age groups, and so those who are most at highest risk. One date of death was from September, which was approved through a third-level review at the state level. 4 dates of deaths are from October, and 10 dates of death are from November. 6 of the 15 cases, 40% of these deaths have been reported with long-term care facility residential addresses. So every day I see all of the cases that come in through Orange County, and so I read through them, and I can see your household clusters. I can see the multi-generational transmissions, so children and parents, and then grandparents and even great-grandparents. And I can see neighborhood clusters, your play dates, your group gatherings. I can see neighborhood clusters, and this is happening all across the county. There are certain areas that have higher rates than others. However, it's like a game of whack-a-mole. So previously, in the beginning of the pandemic, it was easier to try to determine where someone might have been exposed. We had fewer cases, but now we have a lot of cases, and they crop up across the county, and it's everywhere. As the mayor mentioned, so with this context, we're coming up to the holidays. Specifically, Thanksgiving's coming up next week, and then we have the traditional winter holidays that are coming. And this is the time when we usually get together and we gather. And so we want to encourage people to practice good pandemic precautions, but also there are some good guidelines, which we have discussed before, about how to reduce the level of risk that you may have had. So the level of risk that you may present within your gathering. So small gatherings are better than larger ones. Outdoors, better than indoors. Serving potentially, individually packaged items, bringing your own food, observing good wearing of masks and good hand hygiene, and cleaning and disinfecting frequently touched surfaces and objects. I'll turn it over now to Mayor Demings. Thank you.
All right. Thank you, Ms. Hsu, for that update. Just as a reminder, if there's any Spanish-speaking media here, we do have the ability to translate into Spanish. We have someone here can assist with that. Carol Palacio is here to help with that. And with that, we'll open it up for any questions
Hey, Mayor Demings, Danielle Lama with Box 35. You just talked about Dr. Phillips having this event going on, and we're learning that the Solar Bears will be back at Amway and hopefully NBA as well. Can you just talk about like what that means for our community, getting some revitalization downtown, some bigger events?
Well, we're trying to do what we can to keep our economy churning here within the community, and each one of those events that you have talked about allows us to do that. We know that from the summer of NBA play, they know how to be able to really engage and to do it in a safe manner. The same with some of our other sporting events. And now with the arts, we have created this opportunity to be socially distant with the different little individual boxes that they will have on the front yard of the Dr. Phillips Performing Arts Center. Those are going to be ticketed events. The funding that we have been able to contribute to that effort helps to ensure that they have the right sanitary protocols in place and the barricades and everything else that will be up. And it will allow those performers to perhaps get paid as we go into the holiday period of time. So we are looking forward to it stimulating our economy, but also giving us the opportunity to somewhat exhale as a community, to just get out and enjoy the wonderful amenities that we have without adversely impacting our experience with the COVID-19 virus.
Steve Hudak from the Sentinel. This is for you, Mr. Mayor. Alvina had just said that these numbers are a harbinger of things to come. What can you do to tamp these things down? What can you as an executive officer do, given how tied your hands are by the guy in Tallahassee?
Oh, well, we're going to continue with our compliance teams. We're going to continue to distribute PPE in our community to help our small businesses. That helps us protect ourselves from one another. And we are continuing to explore our regulatory authority over businesses. And so we're monitoring these numbers really on a day-to-day basis. And if the numbers stabilize, then we perhaps can avoid more punitive types of measures being instituted here within our community. If the numbers continue to increase, then I'll make a determination whether or not we can use our authority to create some type of fines or penalties for businesses that we find to be non-compliant. I believe that that would be consistent with the authority that the governor allowed local governments to have going forward. I realized today that I was notified that there are some mayors throughout Florida who formed a coalition and provided correspondence to the governor asking the governor to mandate facial coverings to be worn throughout the state of Florida. That remains to be seen whether or not the governor will do that or not. But in either case, here within Orange County, we already have a mandate for facial coverings. All of these experts that we have talked with have said that that is a fundamental ingredient to protecting ourselves from the spread of the virus. So the good news is that it appears that could be some type of vaccine available that will be distributed in our community. Could be sometime towards the end of December to the first of the year. What we have done is to prepare for that. We have a plan of action that you heard us talk about. We have worked in concert with our private health care providers, and we're fortunate to have some great ones here within our community that we are partnering with our health services. And Dr. Yolanda Martinez is here, who is the head of the Orange County Health Services. We work very closely with Dr. Pino and Ms. Shu from the Orange County Health Department, which is a state entity, to make certain that we are well prepared. And so that's what I do on a day-to-day basis, working with this great team of government workers as well as private healthcare experts to make sure that we're prepared and nimble to adjust to whatever may come before us.
Let me just follow up real quickly. The group of mayors in Southport who are pushing for that mandate, your signature is not on that letter, but you would support that.
Yeah, I would support that. You know, because that's what I've been doing. That's what we have done here in Orange County. And I believe that we've had some success with that. The overwhelming majority of people here within our county do wear facial coverings. I realize that it's been such a long time. There's some COVID fatigue occurring, and some people just don't want to do it. But if we all remember why we are doing it, think about protecting every person in your household. That's why we're doing it. So, okay.
A question for our Spanish-speaking audience, please. It has to do with the same topic of the vaccine, the preparations to get the vaccine, and who would receive it first, and what's the plan in conjunction with the state government and local private health providers?
Okay, so Carol, so you want to come to the mic where Ms. Shu is there, and since he's doing it in Spanish, you want to repeat his question in Spanish, and then I'll speak, and then you can translate what I say in response.
Mayor, what is the plan with the vaccine?
If you can
Oh,
do it
absolutely.
in Spanish.
Sí. ¿Cuál es su pregunta?
Ahí dice en inglés, already made in English, pero en español, ¿cómo está, él acaba de hablar de eso un poco, pero en general el plan con respecto a la vacuna, cómo se está trabajando en conjunto con el gobierno del estado, también con proveedores de salud privados, y quiénes la recibirían primero, y estaríamos hablando de cuántas personas podrían recibirla antes del final del año?
Okay. So the question remains the same, right?
Correct.
And you can repeat it in English now so that they'll all hear it.
Sure. So, Mayor, the question is, what are the plans with the vaccines, and who are you partnering with in the private and healthcare sector, and who are you planning to disperse it to, and about how many people will be receiving this vaccine?
Okay. So we are partnering with our local major healthcare providers, Advent Health and Orlando Health, and they will be the primary two local providers, but there may be an opportunity with some of the others. In terms of from the public sector, we are partnering with Orange County Health Department in this effort. And in terms of the priority who will receive it, initially it will go to the frontline workers, which consists of, I know, I forgot. She's supposed to be interpreting this. You got it so far?
I will try.
Okay.
I'll do
So
my
the
best.
frontline workers, which consists of healthcare workers, first responders will be the frontline workers, and then the priority will go to those who are in long-term care or assisted living facilities. Okay.
Estamos haciendo una colaboración con los hospitales, con Advent Health y con Orlando Health, y en referencia de a quién vamos a dar la vacuna, se lo daremos a los trabajadores que trabajan primero con todo lo que es de salud, por ejemplo, los bomberos o los que trabajan en la industria o la zona médica.
In terms of the timeline, we anticipate that it could be the end of December, going into the first part of 2021.
En cuestión del tiempo, anticipamos que en diciembre o entrando en el 2021.
And general public, finally?
The general public will likely have the opportunity to be vaccinated sometime thereafter. It will be based upon the number of doses made available by the pharmaceutical companies.
Y con el público será basado dependiendo de cuántas dosis tenemos de la vacuna.
Hey, Mayor Demings, this is Chris Gordar from West 2 News. I just want to ask you, it seems week after week we keep hearing from Ms. Chu and Dr. Pino about this age group of 15 to 34 or 15 to 24-year-olds really leading in cases here. First, I want to get your thoughts on this group being responsible for such a large share of cases, and ultimately, is there anything you can do to discourage them from taking these risks?
Well, we do have great coordination and cooperation from the school district. We do have Mr. Scott Howard here who can respond to what is happening from the local school district perspective. But also, I am in communication with the president at the University of Central Florida, and I'm sure you're aware that they've made a university decision that students who will go home for the holidays, they are recommending that they not return to on-campus learning until after the holidays, until after the first of the year. And so they will primarily or the virtual or learning or teaching. And I believe that that is being done to, again, because of the population and the demographics that we see amongst these young adults, to preclude the likelihood that they will go home for the holidays, spend time with family and do other things, and then bring it back into the university setting and then widely spread it and cause an outbreak to occur. So this is not just happening here within our community, but happening in some other communities where our higher education institutions are making these types of decisions. And Mr. Howard, would you like to respond on behalf of the school district in any way about what you all may be doing? Some of the teenagers fall within your jurisdiction of the public schools.
Thank you, Mayor. The 15 to 24 range, we know, and we've seen this before, and I'm sure that Alvina Shu can elaborate on this. A lot of it's been college-age students, and I think the mayor's addressed that. We're seeing an increase in cases in Orange County. On our dashboard, we hit the 1,000 case mark dating back to August 21st. But 1,000 out of 85,000 face-to-face students is considerably low in the overall scheme of things. And so we're thinking that the 15 to that 24 range, really we're looking from our perspective at a 15 to 18-year-old student range, and the rest is on the upper end of that. And that's probably where a lot of those cases are happening. And we've seen, obviously, activities that our students wouldn't be participating in on the weekends and other things that's going on. But we think that even in our increasing cases, we're trying to be very strategic and working in partnership with the Department of Health to make sure we're quarantining. And you've seen some pivots, either a full school pivot at the elementary, which is under 15 years of age, but we've seen a pivot at the middle school, and we're monitoring the high school around the corner from them. So we're watching it and certainly are sensitive to it, and we'll continue to monitor it. And we think that Thanksgiving, we could see more of a shift or more of an escalation after that, but we'll monitor it and make sure that we're on top of it and looking towards that as we go through this Thanksgiving holiday. But certainly a concern, and we're definitely in tune with it and working with Dr. Pino's staff and Ms. Chu. So, thank you.
Okay, other questions? All right.
Lara Greenberg, Fox 35. This question is for Alvina. You mentioned family clusters and multi-generational transmission. You also mentioned that I think 11 of the recent deaths were Hispanic. So I was wondering if they were within the same family. And regardless of that, how much are you seeing that happening, the transmission within families?
So I don't have a specific number about I could probably get you a specific number about how many cases are epi-linked or connected to another case. But just from my sense, so I mentioned I basically read through every case that comes in every day. And so yesterday it was like 500 cases. But you can see clusters within households where it's small children and then parents and then grandparents and then next door neighbors. And then from contact tracing, you can identify that the families got together over the weekend to celebrate whatever small gathering. So predominantly the cases are being driven now by small groups. There's not been some large super spreader event necessarily that has propagated the bulk of our cases here. It's small family groups. We know that the virus is easily spread from person to person while you're living in the same household. There's a lot of exposures, and it's for a prolonged period of time. As far as the deaths go, so it has been, the deaths have occurred in persons who are predominantly, if you look at it by rates, it more affects minorities versus whites. And specifically for these 11, I don't have the specific details to say if they were all in the same family or not, but I have often seen multiple household members, almost guaranteed, after a good course of a few days or a few incubation periods, the whole entire family generally gets it, unless you can do the good isolation and quarantine as is recommended. A couple of things that I wanted to bring up about if you decide to have a family gathering, certainly if you are sick, don't go to Thanksgiving dinner. If you have gotten a test and you don't have the results back yet, don't go. There's some recommendations for if you're traveling from far away or from a place that has a high incidence or is seeing a high number of cases that you potentially, it might be a good idea to quarantine for 14 days prior to going to see your loved ones. The range of how people are responding is variable in our general public right now. And so I know we're all tired of the pandemic precautions. And I get tired of saying them sometimes every day, but one example, I was at the grocery store and we were having conversation about like what people were gonna do for Thanksgiving. And I asked the bagger and the cashier, were they gonna have Thanksgiving? And casually, since they don't know who I am, I asked them if they were gonna wear masks. And the one guy was like, absolutely not. It's my family, why would I even consider doing that? And then the other guy was like, absolutely I will, because I don't wanna kill my grandma. So it's two different approaches. I would just, for those who will gather, lower your risk as much as you can, and that is continuing to do the good pandemic precautions. So outside better than inside, smaller numbers, keep it to people that you usually are within your social cohort or who are in your household. Also social distancing and reducing the amount of shared space and objects as much as possible. And then always the good hand hygiene and good cleaning and disinfecting of objects and surfaces. And we'll just note, this is usually, flu and norovirus season, or what they usually, in Australia, they call it the winter vomiting disease. And we haven't really seen that much of it here. So all of these good precautions, not only good for coronavirus, but good for every other disease. So, thank you.
Thank you. Nikki Zizazo with News 6. This question is for Mayor Demings, and if you can't answer it, maybe you could direct me to who you think may be able to. You mentioned that they're going to be extending the hours for testing at Barnett Park. Today, we also learned that at the convention center, they shut down early to kind of process because of the high demand that's going on. At this point, is there any plan in place, as Dr. Chu mentioned, cases are going up. Is there any plan in place to expand testing locations because we're seeing so many people now being tested?
We're evaluating that. Of course, we had anticipated about 4,000 people that would be tested at the Barnett location. We're doubling that number. What we have found is that There are some efficiencies we gain because of staffing. In order to staff these locations, it requires a coordinated effort. So it is the most efficient for us to have that footprint that we have at Barnett, and so we're doubling that. So as we move into the succeeding week, we will evaluate whether or not that works for us. Of course, the convention center location is still a regional testing site that is managed by the state of Florida. And as we look at the capacities for those particular sites going forward, if we need to add testing sites, we'll have to take all of those things into consideration, staffing, et cetera. And does the site that we choose at a location, does it have all of the geography that we need to be able to be successful? So at this point, we'll just have to see. But the reason why we have made the adjustment that I just talked about is because of those evaluations that we do on a daily, weekly basis.
This next question was texted in for Alvina Chu. This comes in from Gabrielle Rossone in the Orlando Sentinel. Her question reads, she would like an update to know if there have been any outbreaks tied to the theme parks and what kind of contact tracing is going on in regards to the parks.
So we have not had any reported outbreaks associated with attendance at a theme park. I mean, as the cases in our community continue to increase, we obviously will see cases associated with people who work at a theme park because they are a very large employer. So that's a number sampling kind of issue. So those kinds of, as we have seen with schools, as the cases increase in the community, we see an increased number of cases which may be school associated or in school-aged children. The contact tracing that occurs is the same as it occurs for all the cases that we investigate. Is we identify the case, we try to get someone on the phone if they answer, and then try to elicit the close contacts and then recommend the quarantine for close contacts and the isolation for the sick person.
Thank you. This next question comes in from Lauren Seabrook from WFTV, also for you, Alvina Chu. Because you're having to prioritize contact tracing, how does it complicate that process when the majority of these cases are ages 15 to 24 and not in the groups being prioritized for investigations? This is something I believe Dr. Pino discussed on Monday.
So actually that group is prioritized for investigation. So we focus on those who are at high risk, obviously. So we have a specific team of investigators working on long-term care facilities and those persons who are medically vulnerable. We do prioritize case investigations for school-age children and also their family members, because we know that this can easily spread within a household. And so when we do the contact tracing, it includes all of the family members in that household, which may be persons who work in critical infrastructure places and also includes other siblings who may be attending other schools or facilities. We focus on, we use the information or the data that we have to focus on the largest age group that is contributing to the pandemic at that time period. So right now we've been focusing on the 15 to 34.
Thank you. And this last one for you, Alvina Chu, comes from Deanna Albritton with WFTV. Alvina, is there any data on the people coming through Orange County testing sites lately? Do you have data? Does it show that the increase in people getting tested is mostly asymptomatic testers trying to ascertain their status ahead of gathering with family, or people getting tested because they think they have it as our numbers go up? Since it's a state-run site, the information about that goes directly to Tallahassee, and also that kind of information is not collected when you go through a drive-through site like that. We do have some information about, the proportion of people who are asymptomatic and symptomatic who have a positive test. But I don't have that right with me. Here, also, can you ask what kind of test, PCR versus rapid antigen, what should people try to get and how many days out if they're going to do so ahead of the holidays? So we went over a little bit about the molecular tests last week.
So a rapid test is really designed, and it works best for people who are symptomatic and within the first 7 days of your start of symptom onset. The gold standard remains the molecular or the PCR test. So people can get the test. So one plan might be to get the test and then quarantine for the 14 days prior before you're traveling. That seems very excessive, but that could be one thought. I just also want to say that getting a negative test today does not necessarily preclude, if you have been exposed or if you have a known exposure, it does not necessarily preclude that you might not become infective tomorrow. One of the insidious things about this virus is the pre-symptomatic shedding period, which potentially neither test may be able to pick up until further along into the course of the illness.
Thank you. And lastly, for you, Mayor Demings, from Ryan Lynch in the Orlando Business Journal. Mayor Demings, with the vaccine storage in place and hospitals preparing for a vaccine to come, what are the next steps the county has to take related to the eventual approval and arrival of these vaccines?
Okay. I have Dr. Martinez here. I know that she's been involved in the meeting, so I asked Dr. Martinez to come forward, and she can maybe talk a little bit about the next steps that they see, the preparation that has been going on. Dr. Martinez.
Thank you, Mayor. Good afternoon. Can you repeat the question? I'm sorry again.
With the vaccine storage in place and hospitals preparing for a vaccine to come, what are the next steps the county has to do related to the eventual approval and arrival of these vaccines?
Well, what we're doing right now is as Mayor Demings mentioned at the beginning of the press conference, is we're in conversations with our partners, our healthcare partners. We're also reaching out to our community partners through the Primary Care Access Network, and also to a variety of other partners in the community, Ryan White partners, so that we are in a place that we're able to distribute vaccines once they get to the county. We're doing a bit of an inventory with them. We've reached out to them so that they can give us an idea of how many staff, how many patients they're going to need to vaccinate, and also about their capacity to vaccinate community-wide. So we're looking at all angles. We're looking within the healthcare system itself, the employees, first-line workers, as the mayor mentioned, the patients that they will have to serve, and then the community as a whole. We're trying to gather as much information as possible in all the angles.
Mayor Demings, one more came in just now from Megan Cruz from WFTV. Mayor Demings, would you be open to very narrow closures or restrictions if cases continue to tick up? Like maybe just a zip code if you're seeing widespread transmission in that area?
We're not there yet. That's kind of a hypothetical thing. I think for me, if there was a next step that we would anticipate going to, it would be creating some type of penalties for businesses that we find to be non-compliant. If you look at our hospitalization numbers, our hospitals are still well under capacity. So that's something that I take into consideration as well. We do look at the positivity rate, but we're definitely able to manage those numbers. And we look at it within a certain cycle, if you will, that 14-day period of time. And if we're seeing anything occurring, through the dialogue that we have with the Department of Health and our internal conversations, we monitor and adjust. So I don't see at this point the necessity to do widespread closings of businesses or shutdowns. I don't see that as something that's necessary in this community at this point. We don't want it to get to that point, and that's why we have these intermediary steps that I'm kind of exploring at this point before we would get to that point. We want our businesses to be successful and to remain open, which is why we come to these press conferences and we plead with the various types of businesses to simply cooperate. they can control their own destinies to some extent by simply making certain that their patrons are socially distanced and that everyone that should be wearing masks are wearing masks in appropriate situations. Okay. If that was the last question, we will be back doing a briefing on Monday of next week, and we hope that you all have a good weekend as we approach this Thanksgiving week coming up. Thank you all for being here.